one of those genes, which is probably the most well known, which is the BRCA1 gene, if you have a defect in that, that can increase your risk of breast cancer to up to 80% in your lifetime. Hi, I'm Senthurun Mylvaganam. I'm a Consultant Oncoplastic Breast Surgeon here at Mums. And today what I'd like to talk to you about is family history risk and breast cancer. So unfortunately, breast cancer is the most common cancer affecting women in the Western world. However, there is a small proportion of the population that has a higher risk than the general population of developing breast cancer. For some of those individuals, that involves a specific defect in one of 12 genes that we know of that can significantly increase your risk of breast cancer. For example, one of those genes, which is probably the most well known, which is the BRCA1 gene, if you have a defect in that, that can increase your risk of breast cancer to up to 80% in your lifetime. And to give you some comparison, a woman in the normal population would have a risk of breast cancer of around 12% in their lifetime. So how do you know whether you have a gene defect? Well, this starts with an assessment either by your general practitioner or by a breast specialist on a family history. Individuals who may be more prone at having a genetic underlying defect will have multiple family members that may have had breast or ovarian cancer. So what's really key is to understand and know about your family history. Do you have any first degree, so that is mum, sister or children who have had breast cancer under the age of 50? Do you have multiple first or second degree family members who have had breast cancer under the age of 60? These are potential signs that you might have a gene defect within your family that is being passed on. To further evaluate that, you would need to have a genetic test. Now these can be done as blood or saliva tests, and the turnaround time is usually pretty quick, within a couple of weeks. This will determine for you whether you have a specific gene defect and therefore what your lifetime risk of breast cancer is. Based on that, there are measures that can be done to reduce that risk, which can either be surveillance, so that's imaging more regularly and earlier than the National Breast Screening Programme, or even breast surgery, which can dramatically reduce your risk of breast cancer. So if you want to know more about your individual risk of breast cancer and what you can do about it, please come along and see me. Thank you.